bayan an yi min aiki ina cikin jinya sati na ɗaya da yi min aiki ya turo min text message ya sake ni.
I be person wey get a lot of friends before. I have no one now because of the smearing. Because of the I don't have any friends. Yes, many people insult me, challenge me.
Lonely tears caused by a condition that has become a burden in Nigeria, with health personnel not skilled enough and health facilities not equipped enough to handle the situation. Obstetric fistula is the continuous leakage of urine, feces, or both. The major cause of this condition is prolonged obstructed labor. It is preventable, treatable, and curable. The USAID-funded Momentum Safe Surgery in Family Planning and Obstetrics project implemented high-impact interventions to support the government of Nigeria in strengthening surgical safety within maternal health by promoting evidence-based approaches and testing new innovations.
When we came on board, really we took a holistic approach to assessing the fistula situation in Nigeria. WHO has the health system approach. We looked at 6 building blocks, and so we looked at it to say, from the human resource perspective, are there enough fistula surgeons, who are able to carry out fistula surgery in Nigeria? And one of the assessments came back to show that we had limited amount of surgeons, and even in hospitals where surgeons were carrying out cesarean section, we also did not have enough doctors, who had the right skill to ensure quality cesarean section, which is actually a cause of fistula, iatrogenic fistula in Nigeria.
And then another critical area is the issue of training of doctors and nurses on the repairs and management of obstetric fistula to make sure that, the government achieves the goal of reducing obstetric fistula.
We know in Nigeria, the government is really the big spender. It has the biggest budget in Nigeria, and so we saw our program as a catalyst to work closely with the Federal Ministry of Health and the State Ministry of Health in Ebonyi State, Kebbi State, Bauchi State, Sokoto, and the Federal Capital Territory.
Part of the intervention was to ensure holistic fistula treatment at all fistula treatment centers.
So before now, we had a policy on ground where when women are repaired, when women have a successful fistula repair, and when they leave, we usually wait until after 3 months or 6 months when they come back before we give them access to counseling and then provision of family planning services. So, and a lot of people find it very difficult to leave that knowledge or idea, believing that the woman will still get pregnant if they are given that. But with the coming of Momentum Safe Surgery and Family Planning, they've been able to educate us better. And now we understand that the fact that if family planning services are provided to women after obstetric surgery, after fistula surgery, when they leave, that even helps them better.
Women with fistula are more likely to be victims of gender-based violence.
Initially, it was difficult. We do not focus on those that have VVF and GBV. We're just on VVF. Then if you come to GBV unit, we see you, we treat you, cancel you, and you go. We can even report. But when Momentum, that was what we had initially, where people will scream for GBV from fistula were rare, because we do not have that manpower, and we do not think it's something we could just easily get, getting GBV from fistula. But when Momentum surgery came, they helped to integrate GBV into fistula.
Before the introduction of Momentum Safe Surgery in obstetric and family planning and obstetric, before actually we don't know how to treat even a simple case of fistula, like patients that delivered that had surgery because of prolonged obstructed labor, which is the major cause of obstetric fistula. We used to discharge them and remove the catheter immediately after 3 days of surgery. So after they develop fistula, and we just refer them to NINGI without even a single treatment. Sometimes the fistula is not a major one. It can be treated with catheter, but we don't have the knowledge until after the introduction of the momentum surgery. So they tell us how to treat the patient with obstructed labor after delivery. After the CS or delivery, we leave the catheter for 14 days. And also we counsel the mothers, the family, and the patient on nutrition and frequent fluid intake, which may help in managing the fistula.
They are our mothers. They are our sisters. They are our daughters. They are women hot by the scourge.
Na samu matsala ta yoyon fitsari sakamakon doguwar naƙuda. An kai ni asibiti. Uwan mijina ta ce ita bata yadda da a yi mini CS ba, sakamakon girman ɗiyan yayi yawa, ban iya haihuwa da kaina. Sai da na share kwana 3 ina naƙuda, ina roƙon likitoci don Allah su taimaka su yi mini CS. Da taimakon Allah sai gashi na haihu. Bayan na haihu na zo na ji ban iya riƙe fitsari. Da na tafi fitsari na kucce min, da na tafi fitsari yana saurin kucce min. Na gaya ma mijina, sai ya ce to mu tafi asibiti. Sai mama shi ta ce ai duk mace da ta haihu dole sai ta ji wannan ƙalubalen na nan take ta yi fitsari, don haka ba matsalar asibiti ta ba, zan dawo daidai. Bayan wata 3 da haihuwa still ina jin matsalar. Na zo gidanmu na gaya ma mahaifiyata ta yi ta min haɗa, ta ce me yasa tun da farko ban haɗi ba, don haka in tashi mu tafi asibiti. Ina zuwa asibiti an ka ce tabbas matsala ce kuma sai an yi aiki a kanta. Na ta Maryam Abacha, an ka sa mini rana, an ka sa mini lokaci, an ka yi min aiki. Bayan an yi min aiki ina cikin jinya, sati na 1 da yi min aiki ya turo min text message ya sake ni. Bayan mun rabu ni ci gaba da jinya, Allah ya sa ni samu sauƙi. Bayan na samu sauƙi na koma gida, an sallame ni daga asibiti. Sai ga Maryam Abacha ta sake kira na ta waya, an ka ce ga masu tallafawa sun zo, an ka tallafa mana, an ka koya mana sana'o'i na hannu, sannan an ka ba mu kuɗi. To alhamdulillah, bayan haka nan kuma sai gashi na zo ni ya aure. Cikin abin nan da na iya riƙe kaina, dama ni ina kasuwanci, na iya riƙe kaina da shi. Na zo ni ya aure, mijina ya sake ƙara mini jari na wannan kiwon kajin da na kai.
After delivery, when I want to go and shit, then I will see shit from vagina and my bottom. The one which from my bottom is too small. So, and I went, I complained for them. Then later see what I'm saying. Then still stitch that place well. The thing is still happening. And then directed me to Norfolk, Abakaliki to come here. And it's me and my husband that followed and came. When I came for the surgery on February, the thing was successful. I'm no longer seeing the shit from vagina again. So, and they told me that I supposed to do the family planning to help myself. And after that, I discussed to my husband, and my husband said no problem, that I should do the family planning. And the family planning was successful.
when I have my second child. My second child is a twins, so I born the boy and the girl died inside. So they took me to operation. So after the operation, I began leak from my body. Piss began come out everywhere on my body. So I began working from hospital to hospital. Even native medicine, I take a lot. Last year, when I go to General Hospital, Vandike, then refer me to Abakaliki, on which I came. They asked me to do scanning, so I do the scanning on Thursday. On Wednesday, I have my operation. The operation is fine, it's successful, and I'm okay.
A lokacin da sanda aka yi aure na shekara ta 16, sanda na haihu kuma ina da shekara 18 na haihu. To na dai naƙuda kwana 3. Daga bayan na yi naƙuda kwana 3 sai aka yi na asibiti. Sai aka min aiki, aka cire min yaro ba shi da rai. Daga baya kuma sai na haɗu da wannan larura. Sai aka sake mai da ni babban asibiti. Sai aka je aka min aiki. To dai gaskiya aikin da aka min babban asibiti bai yi kyau. Sai suka ce sai na koma an sake min aiki. Ni kuma daga nan ban koma. To sai daga baya kuma bara kenan, kaman kusan yanzu ne gaba da yanzu. Sai aka ce an turo ma'aikata asibiti nan. Akwai aiki da ake a Ningi, ana yin aiki kyauta. Dan same ki sai kika ban takarda kika ce min je asibitin Alfara. Sai na je asibitin Alfara. Sai suka ban takarda, suka tura ni. Ranar Litinin in je da safe sai na ga likita. Ran Talata washe gari sai aka min aiki. Da aka min aiki an samu roba tsawon sati 2. Da aka samu roba tsawon sati 2 da sati 2 ya aka cire roba. Washe gari ran Laraba ya aka sallame mu. Gaskiya na ji daɗi sosai. Don tun daga nan ni har yanzu wallahi ba komai. Gaskiya dan na ji daɗin zuwa na nan gidan har ga Allah na samu sauki.
With the restoration of hope and dignity to these women and many others, there is the need to sustain the gains of the Momentum Safe Surgery project in order to end the scourge of fistula in Nigeria.
For us here in National Obstetric Fistula Center, we've planned to sustain this. We owe it to Momentum Surgery. They've done well. They've opened their eyes, and now we're already doing we're already screening and finding results. Already, the unit is established. Gender-based violence unit is already established. It's the one-stop shop. We carry the treatment to them. We don't allow them to come to us now. We carry it to where they are, and we hope to sustain it. We're not going to stop.
It's very, very easy because when Momentum came on board, they were working, hand in hand with Hospitals Management Board. So they were rather supporting us than doing the activity directly. So most of the staffs that were utilized on ground are staff of Hospitals Management Board.
Nobody can do anything alone. You need to, of course, work as a team. So it's essentially to work collaboratively with all our partners and other relevant government ministries, departmental agencies. For example, we work also with the Women Affairs. They are actually in charge of awareness, sensitization, and rehabilitation of victims that have been repaired. So we work with all these people and all other stakeholders in the PVF space to make sure that we are moving from where we are to where we want to be.
Undoubtedly, where there is a will, there is always a way.